Okay, hi. My name's Dr. Ben Newman, and I work on coronaviruses. And I'm going to try to answer your questions from a coronavirologist point of view. Yeah, I'm just one, but yeah. Okay, so a loyal follower asks, so you take two tests. One's positive, one's negative. How do you know you have it? Yeah, good question. One person might have symptoms and one might not. People are going for quarantine for 14 days but are confused now. Yeah, all right, I get how that can be confusing. They wore masks, social distance, thought they were doing everything right, and then after quarantine, what can they do to make sure they don't get it again since they have to work in a daycare in public? Yeah, okay, fine, yeah. Last thing, an elderly person isn't feeling good. How can they stay safe at home and feel better? Okay, fine, yeah. It's a lot of stuff. Let's try. Yeah, so if you take two tests and one is positive and one is negative, then you have it or had it, I would say. The two tests are different in that one is a lot more sensitive, but takes longer to do. The other one is quick, but it's less sensitive. So the PCR test doesn't really give false positives. I have not seen those. We've been working with a thing called the LAMP test. That one we've been having a little trouble with. Gotta say, it's yeah. That one doesn't appear to be as good. Usually it lines up with the PCR test, but I'm not sure that one's ready yet. But antigen testing is the other way that this is done, and antigen tests are fine. They'll give you a true positive, but they are relatively insensitive. So small amounts of virus will not trigger the test to give a positive. So the most common thing would be if you have a PCR positive but an antigen test negative. And I know some of the places in town and presumably other places around here would do both of those tests at the same time. Yeah, it's essentially the same thing. If they're shoving one Q-tip up your nose, why not two, right? Yeah, no big deal. Yeah, so they're both accurate. Neither one gives false positives that I have ever seen, and I'm not even sure how they would. But there can be false negatives, definitely with the antigen test, less so with the PCR test. And the thing with the PCR test is we don't have a better test. So sometimes you'll see the PCR test called the molecular test or nucleic acid amplification test, NAAT. Weird, I don't know why, but fine. It's a quantitative reverse transcriptase, PCR, if you're from a lab. If not, whatever. They're looking for the genome of the virus, the little string of RNA that's inside the virus. Yeah, that thing is the most accurate test that we have. We know that it can reliably detect down to about 100 particles in the sample, whatever size that sample is. But presumably, yeah, you could make a test that would get down to one particle, yeah, and be more sensitive than that. But nobody has been able to do that yet. And so the PCR test is the gold standard. It's the thing we compare against because we do not have anything better. And it's pretty good, yeah. If you were to get a negative PCR test and a positive antigen test, that would be really weird, especially if they were done at the same time. A possible explanation is that they may have used different nostrils, and just because you have the virus doesn't mean you have the same amount of virus evenly distributed everywhere throughout the body, right? Yeah. There's going to be little hot spots. You know, you infect a cell, you don't infect the entire body at the same time, which is how we talk about it, but it's definitely not what happens. It's a bunch of little tiny events that we tend to try to generalize. So yeah, if you sampled a different site, you could get a different answer, but more likely your answer is just looking at the difference in sensitivity between the tests. The other thing that I've heard coming out lately is that if you have, and this will sound really technical, but a cycle time over 35, then disregard it. Yeah, that is nonsense. That is some dangerous nonsense. What does this mean? So when you count the amount of virus, which is what you're doing with the PCR or molecular or nucleic acid test, they're all the same test. You're getting an amount, and the amount should be zero. And in people who are not infected, even if they're kind of around infected people, the amount that you get out is zero. Yeah, very reproducibly, very often. Yeah, you can tell if something's gone wrong in these tests. And then what you're doing is you're counting amount. And so you count it by a thing called cycle time, which is, it's kind of technical, but the amount of virus is going to double every time you run a certain cycle in the machine. And for a while, it's too low. Your machine just isn't good enough to detect it. But eventually, it's going to break through, and you'll be able to detect it. And the point at which you've broken through, whatever cycle that was, that's what they say your cycle time is. Each lab has to undergo a lot of very stringent testing. And what they do in each lab is, for the type of sample they're working with, they will put in little bits of RNA from the virus. So they'll take, like if they're doing saliva testing, they'll take random drool from healthy people. They'll check it first to make sure it's not positive, it's just negative, and then they'll actually spike it with little amounts of the thing they're trying to test. And so you'll put in 50,000 virus equivalents, or you put in 2,000 or 5,000, and you'll run all these different steps. And so you will say, all right, I know I put in, 5, 10, 15, 20, 25, 30, 35, 40, 45, 50, and I couldn't detect it until it got to 50. Then you could say, okay, 50 is my lower threshold of detection. And 50 copies is going to be a cycle time of something like 39 or 40 or 41, something like that. And so when we're talking about a cycle time of 35, we're really talking about, I think it's in the neighborhood of 10 to the fifth, which would be 100,000 individual viruses. And so the conceit here is that if you have less than 100,000 of these little viruses in your nose, you're not even infected. That's not how viruses work. If you're infected, it's kind of binary. You are or are not infected, and if you have any virus in you, you are definitely infected. The thing is also, if you are working under the ideal conditions and you are trying your hardest to grow this virus in the cells where it grows best, you're going to get somewhere between 10 to the fifth and 10 to the sixth copies of the virus out. So the amount that they're saying is the lowest limit that you can possibly even believe is also the highest amount that you can actually make if you're really trying hard, which kind of tells you that all the other people that they're detecting at lower cycle times, which is higher amount of virus, are really, 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 really infected. Yeah, but all these things are bonkers. Each lab will have its own threshold. They will have worked on this. They will have done standard curves where they just test it out with 50, 100, 150, 200, something like that, over and over and over again. And they will know that, yeah, if I have a certain value, I can say it's positive because every time I test it, it's positive, and yeah, it seems to be reproducible. That's science, yeah, just arbitrarily sitting back and saying that somebody else's test result where you didn't do the test and you don't really know what the test is, how exactly it was done, how it was benchmarked, to say that one of those, should be cut off at a different point without any of that data in front of you is really loopy. Yeah, I would say. So yeah, that's a nice little wrap on testing. Last thing. Okay, so an elderly person isn't feeling good. How can they stay safe at home and feel better? Yeah, that's, I don't know if you mean not feeling good because it's like a depressing time of year to not have family around. That's a thing, I'm sure. Yeah, the answer is probably different for everybody. If it's that they have COVID and they're not feeling good, then that's a question for the medical profession, and that's where I would direct that. But for everything else, yeah, I would say it is more important than ever to try to make time to do something that is going to keep you connected. And normally, if you would go and stay at grandma's house, you are around 24 hours a day, and there's a lot of not just the conversation, but little incidental stuff in between. There's a lot of contact. There's a lot of getting to know you time, and yeah, this is what people are used to. Something like a Zoom call, this is 10, 15, 20 minutes of, at a distance contact. It's not really the same thing. You probably need, I don't know if it's like 10 Zooms equals one, regular contact minute, but it's probably, it probably needs to be more than you would think. Yeah, so, yeah. I don't know if that's an answer. I'm not sure I understood that last question properly, but yeah, got to try and take care of the people around you, right? Yeah, that's just part of being a good person, I think. So yeah, thank you very much for the questions, and yeah, best wishes. Like working in daycare and stuff is probably about as risky as nursing right now, except that they don't always have all the PPE in daycare. So yeah, hats off to you. It's an important thing, but yeah, something that people probably don't realize is actually a little riskier than they might think. So I'm glad you're brave, willing to do this, and I'm sure it's helping somebody out a lot. So thanks very much. Happy holidays. I don't know. Yeah. This has been Ask Dr. Ben.